I'm the director of the situation room at the National Ebola Response Center, which means it's my job to collect information on Ebola from all across the country, from labs to beds, to number of deaths, to number of people waiting for an ambulance, to number of unsafe burials. Well, the way it's supposed to work is that if somebody starts to display symptoms, they are to call our emergency line, which is 117.
Hello, caller, this is Ebola Response Center. Hello?
Okay, deploy the line, eh?
Well, here, as you've seen, we have about 50 to 60 operators right in front of each computers, ready to answer every call, every caller that's called 117. Well, they call in because they need help. They call for suspect cases, death cases, even some call for informations. And so when you call, what the operators do here, they take down your details, you the caller first, and after which they also ask the caller for the details of the sick or the dead or the corpse. They ask for those informations and save them, and automatically they save them, it goes to the dispatch unit.
So if it's a suspect case, meaning someone has fever and shows 3 other signs of Ebola, a DSO officer goes out there, inspects the person and see if they meet the case definition, visual inspection. If they do, they call back to their case management unit and they send an ambulance to take you to the holding center.
But we have already investigated this one. She met the case definition, and so we are waiting on the ambulance because we have already called the command center.
On the signs and symptoms, she met the case definition and alerted the ambulance to come and pick her up. So they are on their way coming out.
Ambulance is here. It comprises of the nurse, the ambulance driver, and the 2 sprayers. We give them the form that we had filled for the patient. So since the patient can walk, they are going to disinfect the whole area, the whole house that the patient was in, the toilet, the rooms. So that is the procedure you are about to see.
When your surveillance system is working perfectly, then every new case of Ebola should come from a contact tracing list. I can't tell you this is happening at the moment in Sierra Leone because the numbers that we have been dealing with have just been so high that we have not been able to do perfect contact tracing. We are doing contact tracing. We are doing a lot of contact tracing.
Basically, my name is Alpha Omar Usano. I'm a contact tracer, Ebola contact tracer. Basically, we go in search of someone who will get direct contact with an Ebola person. We find the person, monitor the person for 21 days. Some of them, we went there yesterday. Of course, they told us that there is nobody in there that is sick, so we came there today this morning. We find out that someone is sick, so we decide to alert the authority.
Are you afraid for your own safety?
Yes, there are times because people threaten us. They call us that we expose their relative. Of course, we make them to understand that this is a community work. We just need to keep our community safe, to keep ourselves safe. This is one way we will do it,
The quarantining has deep psychological effects on people. It creates huge logistic problems for us when we come to trying to feed them. Our country doesn't have a postcode system, or in the US, a zip code system. And so finding homes can be quite difficult. So the logistics of quarantine are very difficult. The costs involved with quarantine are very difficult.
Hey, please wash your hand. Because we are quarantined for 21 days. So we are here to provide security for them to receive their movement for 31 days. The government of Sierra Leone supply them the full item and water. So it's not easy, really. It's not easy, but we are protecting ourselves. Well, we are talking to her to take courage every day. I have their list every day, every morning. See them, asking them how they feel, how they are doing.
The real heroes in the fight against Ebola is not someone like me, who really directs operations from here. The real heroes are the burial teams, the hospital porters, the nurses, the ambulance drivers, people whose colleagues are dying by the week. Those are the real heroes. For us, we just put in the hours and try and work as hard as we can and try and make a difference.
I'm Dr. Desmond Mada Kangbai, a Sierra Leonean. I'm one of the facilitators. We are really based on training both national and local staff, preparing them to work in an ETU.
Okay, I'm working for IOM. So today we are having a triage. We are doing something like a concert. How you felt sick before you go to the hospital. As for me, the stage I was doing, I was having fever, headache. So I'm coming. I'm getting fever. I'm getting headache. So the nurse and the doctor will come to screen you.
But this is just like an ETU setting because we bring our students or the people we are going to train just to have the feeling of an ETU.
Okay, so now, okay, you've done everything. So, anyway, you said that the fever is not improving.
We are healthcare professionals. If we say we are all going to leave this country because of the Ebola, then more people will become infected and more people might die, and even our own family members. So we just have to give what we have and we do what we have to do. So we are here again with ION. We are doing our best. We are training people. We are giving what we have to give to them. And I think we are doing a great job.
So the changes in burial policy that we've instituted over the last few months is that now we allow family members to observe the funeral from a safe distance and to be able to say prayers and give some sort of last rites before people are buried.
Well, as you can see, like behind me, it means like basically we're building a whole new cemetery here from the ground up because we've kind of run out of space in the existing cemetery. So we're averaging probably about 45 to 50 a day here and a little over 20 in Waterloo.
It's a stressful job. Can you imagine? Every day, I'm just a worker, but every day I have funeral. When you go to collect some bodies, you see people wailing, people crying, people shouting. You feel bad. That's every day. So it's a stressful job.
We encourage the families to come. You know, they're given like boot covers, masks if they want them. They don't need them. It's just a precaution. But it's 100% different. Like we have imams here now that are supplied by our staff as well as pastors that preside over every burial that we do. So it's just a little touch of dignity to such a tragic event.
We only live in one world, and you can't build walls between us and you. If you don't share your riches with the poor will share their poverty with you. I think it was Joshua Lederberg who won the Nobel Prize for biology that said Ebola represents the greatest threat to man's continued dominance of this planet. And if we don't treat it as such, if we allow it to continue to experiment in the human population to the point where it manages to mutate, then we would have a serious problem where we're not just looking at whether these 3 countries, unknown countries on the west coast of Africa, survive, but whether mankind itself can survive on this planet.